So coming to the next topic about urinary system. So in this picture, you can able to see the kidneys. So these are two kidneys located backside of the abdomen. So we usually call it as retroperitoneal. Retro means behind, peritoneal means behind the peritoneal layer. And uh, this was descending artery, descending aorta. From this, we get a branch called renal artery, and this is vein. From here we have the renal vein. So this is renal artery, this is renal vein, and this we call it as ureter, and this is urinary bladder, and this is urethra. So these are the main parts of the urinary system. So let's go in detail about the urinary system anatomy. So coming to the functions of urinary system, so why do we have an urinary system is which produces the urine. So what actually urine is, it is a waste product came from the purification of the blood. So the purification of the blood is done by kidneys, which is located retroperitoneally, which is behind the abdominal region. So if once the blood was purified, it can create a stable internal environment. Like nothing in excess will not be there in the blood, like nothing in excess of mineral salts such as sodium, potassium, so calcium, all these things in excess will not be there. At the same time, excess amount of water also will be eliminated from the urine as urine, and also it remove the waste products. From the metabolic process, we have n number of waste products. The main waste products released by the body are urea, uric acid, okay, ammonia. Mostly ammonia is very toxic to our body if it lies inside the body itself. So continuously the ammonia has to be released. So that's why the liver will convert the ammonia into urea to make it less toxic than the ammonia. So, and it is continuously removed by the kidney. And by maintaining all this, we can maintain the correct pH. Our blood pH is 7.35 to 7.45. In order to maintain that slight alkaline pH in our body, the kidneys will help by purifying the blood. Coming to the organs of the urinary system, two kidneys, two ureter, one urinary bladder and one urethra. So in this picture, you can able to see, so we have a pair of kidneys located retroperitoneally. Usually the right kidney was a bit lower than the left kidney because the right side we have the liver. Liver pushes the right kidney downwards. So this is the right kidney and this is the left kidney. Above this kidney we have this adrenal glands, and this part we call it as hilum actually. From the hilum, the renal artery will enter, and the renal vein and ureter will exit. So renal vein and ureter will exit from here. Okay, and this is ureter. This is urinary bladder, and this is actually the male urinary system. So in the male urinary system only, you have a gland below the urinary bladder. This is prostate gland. So this gland is present only in the male. And coming to here, this is actually the female urinary system. In female urinary system, the urethra is around 1.5 inch only. But for the male urinary system, the urethra is around 8.5 inches long, so which is extended into the penis. So coming to the combining forms, what and all the terms will comes under the urinary system. Azoto. Azoto means nitrogenous waste. Bacterio, which is bacteria. Cysto is bladder. Glomerulo, which means glomerulus. Glycoso, sugar or glucose. Ketono, which means ketone bodies. So what are ketone bodies means? So when the person is diabetic or when the person is starving or starving, then his urine will get ketone bodies. If his urine has ketone bodies, most of the time the person may be diabetic. Litho means stones. Meato means meatus or opening. Nephro is kidney, so nephrology, which is study of kidney. Nocto means nighttime. Oligo means scanty, little amounts. Pylo is renal pelvis. Reno is also kidney. And urine. Ureter. Urethra. Urino, which is urine. Vesico, which means bladder. Cysto or vesico, both means bladder. Coming to the suffixes, lith means stones. Lithiasis, abnormal condition of stone formation. Usually the stones are very commonly formed in kidneys. Ptosis means drooping or falling from that exact position. Trypsy, which means surgical crushing. And urea, a condition related to the urine. For example, in the urine, if we have glucose, then we call it as glycosuria. In the urine, if we have ketone bodies, then we call the urine as ketonuria. If we have blood, then it is hematuria. Likewise, the terminology will be keep on changing. And coming to the next thing, genitourinary system. So the urinary system in males we call it as genitourinary system because the urethra will extend into the penis around 8.5-inch length, and it consists of two kidneys, two ureter, one urinary bladder, and one urethra. Coming to the functions, so the what and all the functions we discussed earlier, the same thing. So the kidneys will actually purify the blood. By purifying the blood, it removes the waste products, metabolic waste products from the blood. At the same time, so if the blood becomes toxic, if the waste products got built up, so that waste material of the final output we call it as urine. So urine has to be continuously removed from the body. Per day, we release around 2.5 liters of urine, 1.5 to 2.5 liters of urine. And homeostasis. What is homeostasis? Is to maintain stable internal environment. We call it as homeostasis. So to maintain the water balance and chemicals in the body, and also to maintain the electrolyte levels like sodium, potassium, chloride, and bicarbonates, and also for maintaining the proper pH. Coming to the waste removal. So waste removal is done by the system of blood vessels and tubules. Inside the kidney, we have number of tubules. So each tubule we call it as nephron. So nephron is called as the functional unit of the kidney. Per kidney, we have 1 million of nephrons, which means around 10 lakhs of nephrons will be there per kidney. And from these nephrons only, the urine will be produced. And the urine is drained from the kidney through the ureters into the urinary bladder, and finally it will be excreted out of the body through the urethra. And kidney. So coming to the kidneys are located behind the peritoneum. So that's why we call it as retroperitoneal. So you can see in this picture, this is actually the convex side, and this is the concave side, and this is the hilum. So through this only the renal artery will enter, and the renal vein will go out, and the ureter will come out. So this region where the entry and exit will take place, that we call it as hilum. And in this picture, you can see the labeling. The outer part of the kidney, we call it as cortex. This is renal cortex. And this part is renal medulla. And this is the hilum. Renal artery. This is renal vein. And this is ureter. And coming to the next thing, so internal structure of the kidneys. So if we cut the kidney longitudinally, this is the longitudinal LS of the kidney, and you can see here, this is renal cortex. So this is the outer portion, which is renal cortex, and the inner portion is the renal medulla. So in this renal medulla, so this is we call it as renal pyramids. So these are the renal pyramids actually. So, and these peaks of the renal pyramids, we call it as renal papilla. So renal cortex, renal medulla. Inside the renal medulla, we have the renal pyramids. So these peaks of the renal pyramids are renal papillae. And you can see this, these we call it as renal calyx. And these renal calyx, all the smaller passages will unite to form renal pelvis. And the renal pelvis will drain out as ureter. So in this picture, it will be very clear. So this is cortex, renal cortex. This is renal medulla. So inside the renal medulla, we have renal pyramids. And the peak of the pyramid, we call it as renal papillae. And this is renal pelvis. And these are renal calyx, the smaller passages. And this region, we call it as hilum. So in the hilum, we have the renal artery, renal vein, and the ureter. And this calyx. So inside this calyx only, the smaller amounts of the urine will be collected. the papillae will release the urine. So here it got collected. From there, it will go to the renal pelvis, which is the larger area. And from there, it goes to the ureter and empties into the urinary bladder. So nephron. Nephron, we call it as the functional unit of the kidney, which is microscopic. We can only see the nephron in the microscope only. We have around more than 1 million of nephrons in each kidney. In the nephron also we have two parts. One is renal corpuscle and the other one is renal tubule. So this is the nephron. Okay, so in this entire nephron, so this we call it as renal artery, which goes into the kidney through hilum. And from this renal artery, we have a branch. This we call it as renal arteriole. Renal arteriole means smaller branch of the artery. And this renal arteriole will divide into many branches. And this we call it as glomerulus. So this entire ball of, it looks like a ball of thread. So this we call it as glomerulus. And this is efferent arteriole. So this is afferent arteriole and this is efferent arteriole. And this part we call it as Bowman's capsule. Okay, glomerulus and Bowman's capsule. Together we call it as renal corpuscle. And remaining things we call it as renal tubule. In the renal tubule, we have PCT, proximal convoluted tubule, PCT. This is PCT. And this hairpin bend-like structure, we call it as loop of Henle. And coming to this part is DCT, distal convoluted tubule. And this is collecting ducts. So these are the parts of nephron. So coming to the first part, the renal corpuscle. What happens here is the blood will be moving from the renal artery into the renal arteriole, afferent arteriole. From here, the blood will move into the glomerulus. When the blood is moving into the glomerulus, it actually filters the blood into this Bowman's capsule. So the filtrate. So here the collected one we call it as filtrate. So that filtrate will goes into this PCT, loop of Henle, DCT. When it is going through that, so there will be happening some amount of fluid will get back to the body, and some things will be secreted into that filtrate. So I'll show in the picture. So again, you can see in this picture, this is renal artery, and this is afferent arteriole, and this is efferent arteriole, and this we call it as glomerulus. This is Bowman's capsule. Glomerulus plus Bowman's capsule together is referred to as renal corpuscle. And coming to the tubular system, we have this PCT, proximal convoluted tubule, and this is the loop of Henle. In the loop of Henle also, this part is descending limb of loop of Henle, and this part is ascending limb of loop of Henle. And this is DCT, distal convoluted tubule. And this is the collecting tubules. So coming to the urine production, so we have three stages of urine production. One is filtration, and other one is reabsorption and secretion. So filtration means what it happens in the glomerulus to Bowman's capsule, we call it as filtration. There the blood will get filtered, and in the filtrate, what and all the things we needed to the body. So those the body will take back into the body, then we call it as reabsorption. What and all the things not needed, that will be secreted into the urine. So in this picture, you can able to see. So the renal artery, this is glomerulus, and this is PCT, and this is loop of Henle. In the loop of Henle also, this we call it as descending limb, and this is ascending limb. This is DCT, distal convoluted tubule, and this is collecting ducts. And the filtrate is produced is glucose, amino acids, waste products. These things will be there in the filtrate that got collected in the Bowman's capsule. Water, glucose, amino acids, and waste products. So reabsorption. So in that filtrate, some of the things are needed for the body, such as sodium chloride and potassium ions, water, and bicarbonate ions. These things will get reabsorbed back to the body here in these places, in the PCT, loop of Henle, and DCT. And secretion. Certain things are not needed to our body, such as protons, ammonia, urea, uric acid. These things will be secreted into this filtrate itself. So finally, the fluid collected in the collecting tubules, we call it as urine. And ureter. So what is ureter is? So finally, the urine got collected here from the calyx. The urine got collected in the calyx. From the calyx, it go to renal pelvis. From the renal pelvis, the urine will go to the ureter. So the ureter will carry the urine from the kidney into the bladder. So it takes the urine from the kidneys to the bladder. So the interior of the ureter is lined by mucous membrane. And urinary bladder, so which is actually made up of smooth muscles, which is not under our control. So it is also lined by mucous membrane inside. It has many foldings. We call it as rugae. So actually it has the capacity to stretch. So that's why more amount of urine, around half liter of urine will be filled into the urinary bladder maximum. But we will get a warning that we want to urinate by around 250 ml. When the bladder got filled with 250 ml, we will get the signals to the brain that urinary bladder got filled, you have to urinate. And this urinary bladder will lie exactly behind the pubic symphysis. And coming to the urinary bladder, receives the urine from ureters. It stores the urine. It holds around 250 ml of urine. So, and it will go out of the body through the urethra. So actually, under our control, we have only external urethral sphincter. That is the only thing which is under our control. The internal urethral sphincter and the bladder is on the control of the body. So the body controls the bladder and the internal urethral sphincter. The external urethral sphincter alone will be under our control. So if we are holding the urine, means we are holding the external urethral sphincter. If we are releasing the urine, means we are releasing the external urethral sphincter. That is the only thing under our control. And urethra, so which is also lined with mucous membrane, which is around 1.5 inches long in females and 8 inches long in males. So it carries the urine from the bladder to outside the body. And the external opening, we call it as urinary meatus, which releases the urine from the body, which we call it as micturition, voiding, or urination. So all the three means urination only: micturition, voiding, and urination, which means letting the urine to go out of the body. This is male urinary system, because in the male only we have this 8 inches long urethra, which is extended into this penis. So this we call it as urinary meatus. And this is prostate gland. And this is female urinary system. And this female urinary system, this is the urinary bladder, which is present just behind the pubic symphysis. This is pubic symphysis. This is the bone. Just behind this pubic symphysis, we have this urinary bladder. And here we have only 1.5 inch length of urethra. So urine is actually pale yellow in color. 95% of the urine is water. It contains excess of water, excess of electrolytes, toxins. Toxins means urea, uric acid. So these are the nitrogenous waste, ammonia. Normally for around per day, we excrete around 1 liter to 2 liters of urine. Okay, coming to the word building part. So cystalgia. So what is cyst? Anyone? What is cyst?
Kind of growth of cells uncontrolled?
No,
Like,
bladder, call it as cyst.
pardon?
Bladder.
Okay.
Any sac which contains the fluid inside that, we call it as cyst actually. So for example, on the skin, if you have a blister-like thing, so usually accidentally, if we step on any hot object, suddenly we will get blisters. If we have any mild burns also, so that cyst that we call it as cyst. Near the region, you can able to see small bubble-like thing which filled with fluid.
Fluid.
That is, here also, the bladder will be like a balloon-like thing which carries the fluid. That's why we call it a cyst.
Okay, thank you.
Many places the terminology will be common only. So algia means pain. So cystalgia means bladder pain. Cystectomy. So anywhere if you get ectomy means surgical removal, means they will remove the part and they will take out. So excision or the surgical removal of bladder, we call it as cystectomy. Cystogram. So you have to remind three things when it comes to the recording: graph, graphy, and gram. So the instrument we call it as graph. For example, the well-known instrument, ECG. You take ECG. So electrocardiograph means the mission. So what we use it to take the electrocardiogram. That mission name is graph, and the procedure of taking that recording we call it as graphy. And the recording, what we have the paper, what the doctor will write everything in the paper. That recording thing we call it as gram. You got it? Hello.
Hello. The process is graphy and the record is gram, right?
Record is gram, and the instrument name is graph.
Graph.
Okay. For example, if it is cystograph means that instrument, and
Okay.
cystography means procedure of recording. So how we will make the patient comfortable, and we will make the patient to lie down. Later on, we will take the sanitizer and we will wipe the area around the urethra, and we will insert. So all this procedure we call it as graphy. And gram means the final recording. So whatever the record has come out, that we call it as gram.
Okay.
Cystic means pertaining to bladder, pertaining or related to bladder. Cystitis. Itis is very common. You can find in all the systems. Itis. Itis means inflammation. That is universal. And cystolith. Lith means stones. So cystolith means bladder stones. Cystostomy. Ostomy means creating a surgical opening. Actually, there is no any opening in naturally, but we are creating an artificial opening there. So that we call it as cystostomy. Cystotomy. Otomy means cutting. So usually they'll take a knife and before surgery, at the time of surgery, so the cutting the bladder we call it as cystotomy. Ostomy is different from otomy. Otomy means cutting. Ostomy means creating an artificial opening. Cystopexy. Pexy means surgical fixation of the bladder. So these things are very common for all the systems. Cystoplasty. Plasty means surgical repair of the bladder. Cystoragia. So like remain hemorrhagia. So oragia means rapid bleeding. Heavy bleeding we call it as oragia. So rapid bleeding from bladder. Cystoscope. So usually this is the instrument which is used to see inside the body, what is happening inside the body. So they will insert the device into the body. Near the device, tip of the device, they will be having one camera. So that was fitted to the monitor. So we can see inside what is happening. So that instrument name is scope. So if the same instrument is inserted into the bladder, then we call it as cystoscope. If the instrument inserted into the abdomen, then we call it as laparoscope. So the scope is common word. So instrument to examine inside the bladder. Lithotripsy. Lithotripsy is surgical crushing of the stones. Lithotomy, incision to remove the stones. Nephrectomy, surgical removal of the kidney. Nephrogram means recording of the kidney. Nephritis, inflammation of the kidneys. Nephrolith, kidney stone. Nephrologist, kidney specialist. Nephromalacia. Malacia means softening, abnormal softening. So nephromalacia means abnormal kidney softening. Nephromegaly, kidney enlargement, means the kidney will become bigger. Nephroma, oma means tumor, so kidney tumor. Nephrosis, any abnormal condition to the kidney, then you will get a suffix called osis, nephrosis. Nephroptosis, nephroptosis means falling of the kidney. The kidney will not be there in that position, it will fall from that position. That condition we call it as nephroptosis. Nephrostomy, ostomy means we know, creating an artificial opening or a new opening into the kidney. And nephrotomy, incision or cut into the kidney. Nephropathy, kidney disease. Nephropexy, surgical fixation of the kidney. Nephrolithiasis, abnormal stone formation in the kidney. Nephrosclerosis, kidney hardening, which is quite opposite to nephromalacia. Nephromalacia means kidney softening. Nephrosclerosis means kidney hardening. Pylogram, record of the renal pelvis. Pylo means renal pelvis. So pylitis, inflammation of the renal pelvis. Pyloplasty, surgical repair of the renal pelvis. Renal, pertaining to the kidney. Urologist, urine specialist. Uremia means when the blood is present in the urine, then we call it as uremia. Ureteral, pertaining or related to ureter. Ureterectasis, ureter dilation. Dilation means the tube will get widened, so that we call it as ectasis. Ureterolith, the stone is formed in the ureter. Ureterostenosis, opposite to ureterectasis. Ectasis means widening. Stenosis means narrowing. Urethral, pertaining to urethra. Urethralgia, urethra pain. Urethritis, inflammation of urethra. Urethroragia, rapid bleeding from urethra. Urethroscope, instrument to view inside urethra. Urethrostenosis, which is narrowing of the urethra. Urinometer, instrument to measure the urine. So meter, mostly meter means instruments, which is used to measure. Urinary, pertaining or related to the urine. Anuria, a condition of no urine. Bacteriuria, bacteria in the urine. Dysuria, if you have this as the prefix, then it is difficult or painful urination. Glycosuria, so sugar in the urine. Usually glycosuria is the thing for diabetic people. Hematuria, blood in the urine. Ketonuria, ketone bodies in the urine. So for the same diabetes people, they'll have ketone bodies as well as glucose in the urine. Nocturia, nighttime urination. Oligouria, scanty urination. If we have any infection, we will release little amounts of urine. This we call it as oligouria. Polyuria, frequent urination. Many times they will urinate. Proteinuria, protein present in the urine. Pyuria, pus present in the urine. Pyo means pus. So till here is the word building part. Any doubts regarding this? Hello?
No.
Okay. Venkatesh? Hello?
No.
You got the point? Anatomy and physiology of kidneys, nephron, and the word building part.
Yes, I got it. Thank you.
Okay. Rekha?
Yes, ma'am.
Okay, I'll share you the PPT at the end of this class. You just go through all the slides. Next, you have the vocabulary part. In the vocabulary, the coming terms, what and all the terms we use in the urinary system, that will come. So one thing you do tomorrow or today, it's your wish, you go to each and every slide. If you understand this, then only vocabulary will be very easy for you, or else vocabulary will be a quite tough thing. You have to get into your mind the terminology. So all this nocturia, polyuria, anuria, urinometer, urethral, urethralgia, like what is ectasis, what is stenosis, so what is sclerosis, what is plasty, what is pexy, all these things. You have to get used to this. So then the vocabulary part will be very easy for you. Okay, go through the slides one by one and get the point. What is this and how is this happening? Okay, if you have any doubts, you can call me or text me. Okay,
Okay.
Okay, ma'am.
I'll share you the PPT. Okay, if you have any doubts in this class, you can ask me now. Okay, I hope all of you are clear. Okay, so I can take the entire topic in one day, but if I take the entire topic, it will be like stuffing the unwanted things in your brain. Your brain won't accept the remaining part. So that's why I'm making it short and sweet. Are you fine with this?
Yeah,
Yeah.
ma'am.
In the previous classes, the other classes, they'll could take the entire topic in one day, but it will be quite harder to understand the entire topic. So previously the batches was like that. The same thing I'm continuing. For me, it takes around 20 days to complete the whole anatomy and physiology part.
I have one question.
Yeah.
So when are you going to take the class for the half part of nervous system for me?
For you, tomorrow after this class. So not tomorrow, a day after tomorrow,
Monday?
Monday.
Same time?
Can you join the class by 5:30 if possible? So that
5:30 IST?
yeah, 5:30 p.m.
So it will be 8 o'clock. Yeah, I'm fine. I can
Okay.
join.
Okay, then I'll complete the nervous system, remaining anatomy and physiology. Later on, you have only one topic left, ear topic. Ear topic got completed further.
Oh, okay. Okay. You can tell me the suitable time, I'll join it.
Okay,
Like for example.
on Monday, I'll complete the nervous system.
Okay,
Later on,
sure.
I'll tell you when I will take the ear topic.
Okay, okay. Thank you.
Okay. Okay, I'll
And
share. Yeah.
oh, carry on. Please carry on.
Nothing. I'll share the PPT. That's what I. Yeah, tell me.
Okay. I was asking this that you said that like cyst is any fluid filled sac, right?
Yes.
So the cyst in the uterus of ladies or
Yeah.
women,
Yeah.
that is also the same thing.
Yeah, that is also same thing. In
Okay, and it turns into fibroid if it grows more.
yeah, usually the
Okay.
fluid will be replaced with fibers,
Fibers. Okay.
hard fibers, so that we call it as
Okay.
fibroid. So
Okay.
mostly the medical terminology will be Greek and Latin. So
Mm-hmm.
what they will do is it is not English, it is Greek and Latin,
Latin. Yeah.
because it was an ancient science. So we took
Mm-hmm.
it, and why they selected Greek and Latin means we have only there is no synonyms. For example, if it is cardio, universally
Mm-hmm.
cardio means heart,
Heart. Yeah.
because health is a universal thing, right? So we can't
Mm-hmm.
change. If we go to any other country also, if we show our reports, they can able to interpret very easily what it is.
Yeah.
So that's why they opted for Greek and Latin. If why not English? Why not Hindi? Means even for English also you have different accent and different words.
Yeah. Yeah. American accent is different. British accent is
Britain
different.
accent, even Indian accent was
Yeah.
different. Indian
Yeah.
accent,
That is true.
it was like
Yeah.
a
And
hybrid.
spellings is yeah. Spellings are also different in America and UK
Yeah,
for
yeah.
some words.
For Greek and Latin, there is nothing like that.